autoimmune case or is it a genetic malformation case? So whenever any case comes to you, we want to classify this disease, classify the disease in front of us according to aphorism number 5. Where is it an acute disease or is it a chronic disease? The chronic disease can even go up to the autoimmune disease or to the genetic malformations. And our case taking and approach differs from case to case. Yes. So the whole point is we all know how to do the case taking. In an acute case, what are we going to look into? We want to look into the physical trauma and the mental trauma there. Some acute exacerbations will be there. Some acute reasons will be there or stimuli will be there, which have given us that defense, which has given us that defense of inflammation. So we are looking into this thing, whether it is inflammation or construction or destruction. So there are only 3 defense mechanisms possible in a person. If it is an acute case, we look into the ailments from. We look into the ailments from the physical trauma or the mental trauma. This is what we have been reading all through. So the SORA, the psychosis and the syphilis, that is the inflammation, construction and destruction. So I am saying this again and again because in the maze of the symptoms, we will be lost onto what disease are we dealing with. Yes. So if it is an acute case, it is easy for us. According to the acute chart, we have to classify the disease into dull, chilly, thirsty or dull, chilly, thirstless or dull, hot, thirsty and hot, thirstless, or looking into the other activities which Vijayakar sir has given us nicely. Looking into that desktop chart of the theory of acute cases, theory of acute cases, you will be. Yes. So shall we change the? Yeah, please note. Okay. So you just have to take in the ailments from there and prescribe according to the knowledge of the materia medica, looking into the disposition. Coming to the chronic case, what are we going to do? We want to give the genetic constitutional simillimum. How is this simillimum taken? By doing the case taking elaborately, we form the totality of the symptoms. Now the $1 million question is, can we prescribe based upon the totality alone? Can we collect the symptoms alone and prescribe based upon the symptoms alone? It is not possible. It is not possible, guys. So when you are prescribing according to the totality, you will be missing certain points. And when you are prescribing according to the symptoms, you are missing the pathology there. So we want to know the pathology. Always make a pathological prescription and always make the miasmatic prescription. This is why we are reading this book of Praful Vijayakar sir, The End of My Assumption of Miasm. You have to give the miasmatic prescription. Taking the case and giving the prescription based upon the symptoms is not real homeopathy. You will be cracking only you will be able to give only the partial simillimum there. You will be able to cure only that much symptoms of the patient. According to the symptom similarity, you have to match the medicine, that's all. But then the case taking should be based upon the pathology, what you're dealing with. You want to know the diagnosis there. You want to look into all the CT scan reports or the MRI or what is the disease that you're going to deal with here. That is aphorism number 3. The physician should be able to find out what disease is he dealing with. What is the kind of the pathology that you're going to deal with here. And based upon that, you can put that into the miasm. You can understand the miasm of the disease there. Every disease is tri-miasmatic for that matter. And every medicine is tri-miasmatic, or at least all the polycrests are tri-miasmatic. And all the patients, all the persons who are dealing with are tri-miasmatic. SORA, psychosis and syphilis are inborn there in everyone. In the nature, it is there. So everywhere you can see the tri-miasmatic disease. Every tri-miasmatic nature. Every disease is tri-miasmatic. Why? Because every disease starts with the inflammation and slowly it goes into the next disease of construction. And eventually, when all these defenses fail, it goes into the syphilitic thing. So syphilitic defense mechanism. So whatever diseases come to you, if it is a chronic case, you know that you have to give the GCS. But for that, you should know the pathology and you should know the miasm. So is it a psychotic miasm or is it a sauropsychotic miasm or is it a psychosyphilitic miasm? In all these 3 cases, you can give a GCS. But if it is pathologically very severe, then you will have to give the PCS, that is the pathological constitutional simillimum. Yeah. So if it is the pathological simillimum, after that, when the patient comes out of the disease, if he is going on improving on and on, you don't have to change the medicine. But if he has come out of the pathology very nicely, and if there is a standstill, or if new symptoms are coming up, which is not in according to our judgment is not good for the patient, then you have to change the medicine into the genetic constitutional simillimum. There, what will you give importance to? You have to give importance to the sensitivity of the patient, that is the SORA. You have to take care of why has this disease come to this extent. Why did the disease start from the inflammation and go on and on and on and reach the level of pathological destruction? And that is where we gave him the pathological medicine, pathological constitutional simillimum. From there, we are reversing the patient into the normal with the good generals and all that. And there, the patient has stopped the improvement. Then is the time to give the genetic constitutional simillimum. So it is not mandatory that every time after giving the pathological symptom, when the patient is improving, you don't have to interfere at all. You don't have to stop that pathological and give the GCS. Many students have this doubt. So after giving the PCS, you have to immediately give the GCS. That is not the rule. When the patient is improving, don't interfere at all. Once the patient stops improving or some detrimental symptoms are coming up, or the patient is going back, then you know, okay, according to the Herring's law and according to the layers of the diseases suppression chart which Vijayakar sir has given us, you can judge, and according to the energy levels, you can judge whether the patient is in the improvement phase or not. As long as the syphilitic symptoms are coming down, your medicine is correct and you don't have to change immediately into the GCS. When the improvement stops, take the sensitivity of the patient and give a GCS. And coming to the autoimmune disease, if it is an autoimmune disease, what are you going to hunt for? You cannot give the genetic constitutional simillimum in the autoimmune cases. Why? Because already the immunity is gone there. Immunity is reckless there. It is pointing towards himself. His own immunity is killing himself. So here you will have to pick up the again, the PCS you will have to pick up here. In pathologically grave diseases, you have to take the PCS, and in autoimmune diseases, you have to take the PCS. So here again, you will have to, here we cannot name it as PCS. You will have to take the autoimmune rubrics. What are the autoimmune rubrics now? Where the life is threatened, where the existence itself is threatened. So autoimmune disease also begins as psoriatic disease, begins as the ectodermal disease, and then it goes into the layer 2, layer 3, layer 4, layer 5, 6, or even in the layer 3 itself, it can go into the autoimmune level. How? It can even bypass the other layers. It is not a rule that the disease has to always climb the ladder one by one, climb the step one by one. So after the first layer, it can go directly into the autoimmune. Even in the third layer, if the patient is having the normal musculoskeletal diseases, it can go into rheumatoid arthritis. It can go into arthritis deformans. The patient is in the level 3, and the patient is having the physiological, arthritis in the beginning. There is only the joint pains, or what is it to say, the normal arthritis kind of thing. And where the defense did not help, it goes into the next higher defense, that is the constructive defense. The patient is in the same layer 3. That can be gouty arthritis, or there can be arthritic nodules can be there, or the difficulty in bending the joints can be there, and slowly it goes into the autoimmune variety. Did the patient go into the 6th layer and all here? No. The patient is still in the 3rd layer itself, but then there itself the patient can go into the autoimmune mode. When it has gone into the autoimmune mode, it will be kind of a syndrome. The presentation will be kind of a syndrome, like a rheumatoid arthritis or a Sjogren syndrome or whatnot, where the entire system will be affected. And here, you know that, okay, the musculoskeletal system is predominantly affected. If the case is a multiple sclerosis case, yeah, it is of the syphilitic miasm, but still you will have to give importance to the autoimmune mode here. So you will have to find out where did the patient change his defense into the autoimmune? Why did the patient go into the autoimmune mechanism? And where did the body, the vital force, fail to recognize that this immunity or this antigen is my own antigen. Why is my body fighting against my body? Why is my antigen not helping me? Or it is rather going into destruction. So that is the point where what you have to find out in the autoimmune diseases. That means something detrimental to life, something detrimental to the existence. So here you will have to take the existence rubrics or the death kind of rubrics. Not like the death desires if it is a slowly progressing disease. If the syphilis is the destruction is more, if it is frank syphilis, if the destruction is more, then you will have to take the suicidal rubrics like the SDO, STO, and all that, no, like suicidal disposition of, suicidal thoughts of, or insanity, suicidal, or mania, suicide, etc. No, there's such kind of suicidal rubrics you will have to take. The death desires and all will be of the slowly progressing disease. So such kind of autoimmune rubrics you will have to pick up if you are dealing with that kind of a disease. And if it is a genetic malformation case, you will have to always interrogate the mother's history, the pregnancy history, the mother's pregnancy history, according to the like if it is a structurally damaged thing, then the initial trimesters you will have to take, that is the first 4 months. And if it is a functional damage, then you will have to take the later 4 months, that is from the 6th month to the 9th month. And accordingly, you will have to prescribe. And in the genetic malformation cases where the genes are affected, do you think that the genes, are we capable of doing the genetic engineering? Do you think that the genes are becoming normal here? What is happening here exactly? How are the genes made up of? Whether it is an RNA or a DNA, it is made up of the proteins, the nucleotides. And here, as long as the vital force is having the so-called homeostasis, the genes or the proteins are all in the proper alignment. If it is disturbed, it will break. And then we call it as a viral disease. It will be thrown out into the skin from the neuroectoderm. It will be thrown out into the skin and it will be showing in the form of eruptions, reddish exanthema and ananthema. All the pox marks, everything will be there. And sometimes only the throat infection will be there. The exanthema will not be that very obvious, but then the ananthema will be there. You can see the viral throat in the palate. Nowadays, we see regularly in almost in every case who are complaining of the throat infection, we are getting the viral spots in the palate. So that shows that it is a viral thing, or somewhere the disturbance has affected the genes. Affected the genes means here there will be no mutation and all that, but then the genes are broken, which means what? The DNA is constantly adjusting, and this adjustment is possible. So which means what? Genetic engineering is possible. Sometimes there can be an addition of a gene, of a chromosome, or there can be translocation of the long arm and short arm of the chromosomes, or there can be deletion of the chromosomes. All these things are possible to be treated in homeopathy. Yes, it is possible. The body, if it is in the proper alignment, when the positron is given, the body gets that proper alignment where the proteins also go into the proper alignment, making the genes normal. So nowadays, the science has come to the proteomics level, bypassing the genome level. Previously, it was like genes control everything. And now we say that proteins control everything because genes themselves are made up of proteins. So here our medicines go and act and correct at the cellular level, at the protein level, it corrects. And then whether the short arm, long arm, forget about that. But then when the protein alignment is proper, the entire vital force becomes proper, and it happily, the affected person happily blooms out into a beautiful individual. And then comes the sora again for him, where he gets the cold, cough, etc. And then comes the psychosis again. And then we will be going into the syphilis later. We are in the psychotic thing now. So this is where we are now. This is what we have learned so far. Okay. So taking the gist of that, whenever a case comes to you, is it an acute case? Is it a chronic case? Is it an autoimmune case? Or is it a genetically malformed case? If it is an acute case, how to deal with that? Take the physical trauma or the mental trauma, take the ailments from rubric, simple. And take Vijay sir's chart and rule in and rule out, find out the disposition and give the medicine. In what potency in SORA? Either in the 200 potency, or if the symptom similarity is the best, you can give 1M potency. That will be the ideal potency in SORA. And coming to the psychosis, we want to give the genetic constitutional simillimum there. And for that, we want to know the JOD, the journey of the disease, and what all diseases so far the patient has undergone. Everything you have to write, and everything you have to mark down the layers, and then of course you know the take the entire case and find out the totality, match it with the pathology, find out the exact miasm there, and give the medicine. The ideal potency will be 200 in psychosis. So now the king of psychosis is medorinum. We say no, the king of sora is sulfur. And what is the king of syphilis? Maybe syphilinum? What is the king of syphilis? Even I don't know that. King of
Merc, ma'am.
Merc?
I don't know. I'm just asking.
Can be Merc.
Or
Can be.
syphilinum.
I don't know. Maybe syphilinum? Yeah, could be. But then we generally talk about the king of sora, that is sulfur, and the king of psychosis is medorinum. And we talked about the mental symptoms in sora, that it will be in the form of anxiety. All kinds of anxieties. Anxiety can be in multitudes, because it will be very, very elaborate. For anything and everything, you can be anxious. We dealt with that in our previous class. And today we are dealing with the king of psychosis, that is the medorinum, the fears. In psychosis, everything will be in the form of fears, that it will be what to say, specific fears. It will not be the generalized. If it is generalized, it will be the anxiety for health, etc. Whereas in psychosis miasm, fear, it will be directed to specific items, specific symptoms, like fear of cancer disease, or fear of paralysis, fear of heart disease, etc. In anxiety, like it will be anxious about anxiety of health, or anxiety hypochondriac. It will be more generalized. Whereas in psychosis, it will be more specific. Here we have dealt with many fear remedies, no? Like we don't want to go into each and everything. It is page number 141. Page number 141. So in medorinum, we have seen fear of being alone, fear of animals, fear of cancer, fear of something creeping out of every corner, fear of impending disease, fear of disease being incurable, fear of evil, fear of examination, fear of falling, fear of having a fit, fear of ghosts, fear of something will happen terrible and horrible and all that, and fear of imaginary things. And there are other medicines as well, no? Like belladonna, stramonium and all are having fear of imaginary things. Fear of insanity, losing his reason. Fear of misfortune, fear of narrow places, fear of noise, fear of suffocation, night, fear of water, fear of suicide, fear of unknown. So there are, see what is Vijay sir trying to say here. In psychosis, there will be a bunch of fears in you. That doesn't mean that you don't have anxieties at all. You will be having anxieties in the background. As long as sora is there, you will be having all the anxieties. On top of the anxiety, you will be having specific fears. All these fears may not be there in one person, but all these fears are there in one person means what? He is medorinum. He is medorinum. So this medorinum is still having, in spite of having all these fears of certain specific things. Yes, as against this long list, we have the anxieties also, which form a short list there. Anxiety anticipating an engagement. Anxiety in the chest, in region of the heart. Anxiety in the chest, okay? Pulsatilla is the best medicine. We can give pulsatilla testing. Pulsatilla 10. So anxiety of conscience. Fear of death doesn't come in synopsis means what, dear? In psychosis, yes. Fear of death comes. All the fears are psychosis. For that matter, all the anxieties are soric. All the fears are psychosis. And all the anguish or the fear, overpowering fear, that means the panic attacks will be the syphilitic variety. All the fears are psychotic. Anxiety in the region of chest, anxiety conscience, anxiety about health, anxiety about salvation, anxiety on walking. All these are the anxieties also of medorinum. So see, what does this mean? all the anxiety rubrics are of the soric variety, the fear rubrics are of the psychotic variety, and are we going to take any fear rubrics in our daily clinic? All the fear rubrics are psychotic. How much weightage will you give to the psychotic rubrics? When the patient is blah, 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 giving his symptoms, you know that all these things are facade. So what are we going to give importance here? What importance, for what element are you going to give the importance here? What the patient is saying is not important. How the patient is saying is important. Yes. And the pathology is important. Yes. If the pathology is there, you know exactly what you're going to deal with. Whether whatever symptoms the patient is giving us are only psychosis. And only if you know the psychosis, you will be able to keep aside the psychotic element and pick up the syphilitic rubrics. This is the importance of psychosis here. You are not going to prescribe upon the psychosis. But then is it always like that? If the child is going towards precocity, the child is still in the soric phase, you can always think about, you can always take the precocity rubric there, and you can even take the fear rubrics there when you're dealing with the soric cases. Yes, the psychotic rubrics will help you in the case of soric cases or in the sauropsychotic cases. For the beginners, I shall give you one case. It was a fever case. It was an old lady. Yeah, it was an old lady of around 70 years old. And she was always a cheerful lady. That day she was coming. That day she was coming with a lot of, she was not weeping. She was in so much of anxiety with high temperature, 104. For a 70-year-old lady with 104.5, it was all burning. It was all burning. And the patient was sitting with drooped eyes. She was not even able to open her eyes. And she was in full of anxiety. She was moving like this, like this. She was having that restlessness. Then I was wondering what to give based upon the acute chart. But then here, the highlight was moaning. That is again a psychotic rubric. Moaning and groaning is a psychotic rubric. But then the case was a soric case, no, high temperature, fever, yes. So the patient was doing, ah, ah, ah. So I took that, moaning with fever, moaning with heat, and came out Pulsatla 3 marks. So I gave her Pulsatla because the patient, yes, Sophia, Pulsatla, yes. And she recovered beautifully. In how many days? In 6 hours. The temperature came down to normal. And the next day morning, I saw her in the evening. And the next day morning, first patient, she was coming with all smiles. And she was asking me, what wonder medicine did you give me, ma'am? I slept well yesterday. After going here, I did not feel any disease. The fever was all gone. So here I made use of a psychotic rubric. I did not hunt for syphilitic and all that. So everything is important for a homeopathic thing. Only it should be a miasmatic prescription. So was it a miasmatic prescription here? The case I was dealing with was the soric case. And the medicine I has given was of the higher variety. That's all. This is what is meant by miasm. And this is the reason why you should know the miasms. Even psychotic miasms, my psychotic symptoms are very important for us to judge the case, to give weightage. You should use that intelligence. That's all. And I generally used to say these rubrics on the basis of higher miasms. Exactly, Sai Narendra. Previously, I generally narrate this case. I often keep this case as an example case for the junior doctors, that the wheezing case, wheezing asthmatic bronchitis, where I have cracked the case by using a psychotic rubric that was vanity and foppishness. Based upon that, I have given lachesis to the girl and she improved very well. So, so it was what miasm is it? Asthmatic bronchitis is a simple soric, but then the patient was going towards the syphilis, of course, but then I could easily crack that by taking the rubric psychosis, because the child was having that foppishness and see, all sorts of rubber bands, everything was put on her hair. So like fountains, her hair was there, and all sorts of hair bands she was putting in the hand also. So I considered that as foppish. That is, and I ruled it out with lachesis and veratrum album there. Initially, I gave Veratrum, it did not improve. After that, I had given her lab cases based upon the one more rubric, that was impertinence. I always tell this case, that's why I don't want to elaborate on this case. So using the psychotic case, you can always crack a psoric case. Even if it is a very severe psoric case, you will be able to crack. So now, yeah, okay. So that is the next paragraph. That is, he is giving us a note here, our sir. This does not mean that a predominantly psoric sulfur or psorinum will have more anxieties and less number of fears or vice versa. What does this mean? Every medicine has got psora, psychosis, and syphilis. Every medicine is trimiasmatic. Every patient is trimiasmatic. Every pathology is trimiasmatic. Destruction cannot happen without psora. For every disease, there will be a psoric element, a psychotic element, and a syphilitic element. Every disease, every destruction begins with inflammation. After the inflammation comes in the constructive defense or the destructive defense according to the predominance, genetic predominance of the patient. Yes. So every medicine will be having the anxiety symptoms, the fear symptoms, and the, yeah, as you go ahead, the syphilitic symptoms will be there. So this changes the, what to say, according to the gradation or according to the genetic predisposition, there will be difference in the degree. That's all. A remedy which is broad spectrum, meaning triamiasmatic, or in homeopathic language, we call it as a polycrest, will have psoric rubrics, psychotic rubrics, and syphilitic rubrics to represent the miasm which they cover. This is the base of my trimiasmatic materia medica. So every medicine has got psoric symptoms, psychotic symptoms, and syphilitic symptoms. Now coming to the next paragraph, that is happiness. So how do we find psychosis in happiness? Psychosis can be psychosis excess or psychosis less. So if it is excess, what is that? What is that? The overexpression quality of psychosis will make the psychotic individual project his happiness in such a manner that it will indirectly promote his selfish interest and motives. What is that now? How can we see a psychotic happiness? You ask about the stress, no? What is the stress for you? What had happened to you at that month? Because from that month onwards, you felt sick. You were never well after that particular month. What had happened then? Patients say, no, I am always happy. So what is this? This is the psychotic happiness. So how can you find it out? The patient will say, no, see, nowadays we are not having any stress now because we have bought a pet there. We have a pet dog. Yeah, we have a doggy. And we are all very happy because he will not allow us to be sad and all, doctor. What is this? A total psychotic answer. Or the patient will say sometimes, I will switch on the music and hear the music. Huh? What is this again? Very, very psychotic answer. So they say, I'm always happy. So this happiness will be like kind of distraction for them. So, okay, you know how to tackle that. You know that this is only the psychotic rubric there. So they will project the happiness that I'm always happy because always there is song in my house and or gardening in my house, always flowers bloom around and see, all these things are artificial happiness. This is what a homeopathic doctor has to know. According to their own selfish interest and motives. And see the next line. He will use his money, position, power to celebrate a small occasion to such an extent that the occasion is sidetracked and it is his richness or importance which is highlighted. Accelerating exuberance is heightened joy. Yeah. So this is how the psychotic thing will be projected. Now coming to the next thing, that is the mirth. The meaning of mirthful, according to Webster's dictionary, is full of or expressing merriment, joyfulness when characterized by laughter. Laughing loudly. Everybody will laugh, right? Laughing is a sin, is it? No. But then all these laughing persons are psychotic? No. There can be psoric laughter also, no. But then sometimes the laughing can be like smirking or laughing like mocking others. There can be psychosis less. Or laughing on the sly or cunningly laughing or laughing in the intention of hurting others' feeling. That can be psychosis less. Somebody will be laughing like a heartening laugh, it will be. A loud laugh, it will be. Laughing loudly, laughing at trifles, causeless laughing, laughing immoderately, sarcastically, scornfully, laughing to hide grief. All these are psychotic. Psychosis under expressiveness will have subtle, concealed, sardonic laughs or never laughs. They will never laugh. That can also be psychotic quality. So who will laugh? Who will laugh causelessly? Causeless. No need to laugh at all. Without any cause, they will laugh. Either it can be Beraita, Buforana, or it can be drugs like cannabis or stramonium and all. And again, who will laugh immoderately? They don't know the limit.
Cannabis,
Cannabis, belladonna, like drugs or Beraitas.
Right.
That is the easy way to rule in and rule out or to remember. You don't have to by heart everything. So it can be belladonna, cannabis, hyoscyamus, stramonium. Moschus or the hysterical remedies can also laugh immoderately. Moschus, ignatia, yes. Crocus, again, what to say, an hysterical remedy. Tarantula, yes. And can you morphinum? Morphinum, yes. Okay, I don't know about that. Now, laughing never. This person never laughs. Who can that be? Very serious person. Gold-headed cane. Ourselves. Very proper. And even if they laugh, they will produce that laughing in syllables, I should say. I have seen patients like that who are workaholics, who are very fastidious about their work rather than workaholic. Workaholic means what? Here in ourselves, they cannot rest unless the work is done properly. Too proper. They cannot rest unless the work is done. Yes, Kusum, I shall come to that. So they want everything to be noted down properly and all that. And they will be rather stiff, and the dressings also will be so very ironed and that kind of a safari suit of subtle colors, sober colors. And when they come itself in their movements itself, that fastidiousness will be shown. Yes. Okay. And how will they laugh? Can they laugh? Yes. Very serious. They're inspecting something and they're inspecting the files, etc. And they will laugh. Meticulous. Yes, Swati. Meticulous. Yes. Very good. I am describing about ourselves, okay? I am describing about ourselves. Very fastidious in their dressings, very fastidious in their writings, in their books, in their handwriting, in their noting down the way they put the checklist, everything, and the way they talk, the way they frame the question. Will there be any mistakes? There will be no mistakes because they are already prepared. Why? Anticipatory anxiety for ourselves. If they are going for auditing, if they are going to inspect something, yes, I am narrating about some person. Some person is there in my mind who always come to our college for inspection, and all the doctors will be having this turmoil, whether this is ready, that is ready, and all that. They all will go run panic, but this person will come calm and quiet, and he will be ordering for things in such kind of a grace. He manages the whole thing, and we will think that this person is not at all anxious, but the anxiety is all worked out the next day night, the previous day night itself. Everything is jotted down, everything is written down, everything is ready. So there is no need for there is no point of mistake. There is no point of forgetting anything. So he is complete. Who is that? Ourself. Ourself. And how will this person laugh? Either he will never laugh. Arsenic alb 3 marks. Never laughs. Or he will laugh kind of in syllables. I don't know whether that is there in the repertory, but then he will laugh like this. That is ourself laugh. He cannot laugh freely. Ourself laugh. Balam pidichu anchi. That is also studied and rehearsed. How will I laugh in front of others? If at all I have to laugh like this. So this is the gold-headed cane. That elegance, that grace, that anticipatory anxiety converted into a very, very staunch, very complete person. Raymond, that is the brand also. Okay, it can go to the other level of Veratrum album after some time if it goes into the syphilitic thing. But then this person was not a show-off person and all. He is particular to the whatever he is doing, to his designation. So never laugh. Arsenic album is the first medicine that should come to your mind. Then laughing loud. Again, the drug remedies, belladonna, hyoscyamus, stramonium, opium, cannabis, or the hysterical thing, laughing loudly, crocus, etc. Laughing on trifles, again the drugs and the hysterical. Again comes our hyoscyamus, stramonium, tarantula, cannabis indica, nux moscata. Nux moscata is a hysterical remedy, and moscus and crocus. Okay. So this is how you easily try to remember the medicines. Yeah. Okay. 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 So now we will go to the next paragraph, that is the grief. We will talk about the grief after finishing off about the laughing and the mirth. We come to the grief. Now, how will you express grief psychotically? How can one over-express her grief? In psychosis, you have to either over-express or under-express, right? Over-expression is very interesting. By crying, by wailing, or to attract pity or sympathy of others is the characteristic of psychosis, over-expressiveness. It can go into the lamenting thing. I shall give you a case. The case is nothing but a soric case. Yeah. It was a case of a diarrhea. How many times diarrhea? 10 times diarrhea. And how is that, like you ask about the specifics. Yeah. The patient says, every time I pass, it will be like too profuse, too copious, very profuse. And I have got severe pain in the abdomen. And the patient will not even narrate all these things. The patient will be lamenting how the patient is, Ayo, Vayaye. This is lamenting. Doctor, enike Vayaye. This is lamenting. Lamenting and profuse diarrhea. Veratrum alb. 1 dose. There is no loose motion after that. Yes, before that, the mind becomes normal. There is no lamenting after that, and the patient gets that confidence, and the face becomes happy, and the patient will ask for some water to drink. Yes, there is no pain, there is no spasm in the abdomen. Yes, so this is the case. Lamenting. Veratrum 3 marks. Other medicines are also there. When it is coming to the loose motion, you will be giving Veratrum for a lamenting patient. Yes. Yeah, of course, there are nux vomica also. You will have to differentiate that. Aurum, Lyco, nux vomica, pulsatilla, Veratrum. These are all the lamenting remedy, 3 mark lamenting remedies. Okay. And in certain cases, no, there can be loud, piercing lamenting. Arsalb is the remedy. Loud, piercing, lamenting cases. I have cured a case of autism. The child was sitting in the waiting room. We are dealing with some other cases in the consulting room, of course. We are hearing that sound. What is that sound? Kind of, it will be like the hooting sound of a train. Loud, piercing, lamenting. Arsalb. Your child is watching the drama here. Welcome to the homeopathic discussion. Tomorrow he also will become a homeopath, because so much is there interesting in homeopathy. How we can judge the patient just by hearing a noise. You will be able to come to the prescription point. Yes, only if the mind perceive what the eyes see. No. So that is the grief. And how will it be in the psychotic less? Moaning, grumbling, involuntary sighing. Yeah, moaning, we told the example. We already talked about the example of pulsatilla. Moaning, groaning, involuntary sighing. Who is the leader of involuntary sighing? Which medicine? Ignition. That is the psychosis less. Why this involuntary sighing happens in Ignatia? Because of the hidden grief. Because of the hidden grief. Now coming to the next thing, that is the anger. Psychosis excess in anger. How will it be? Psychosis excess means accumulation. Yes, collection. When such an accumulation takes place in arterial walls, the arteries get thickened to give rise to arteriosclerosis. This is a gradual process. This pathology gives rise to resistance to flow of blood. The resistance occurs also due to thickening and accumulation of fats in the surrounding tissue as well as inside the blood, that is hyperlipidemia. So if there is psychosis excess in the mind, there will be psychosis excess in the body. So if the patient is coming with arteriosclerosis, there will be already a psychosis excess in the patient. And the patient, you know that it is an angry patient. When there is an obstruction or resistance means what? Again, it causes anger, right? Obstruction or resistance to any smooth flow, everything is slowed down. Naturally, the reaction is bound to be anger. Even the heart muscles, which could not pump the blood to different parts easily, feels that unnecessarily it has to put on extra effort. Who will not be angry? Who will not be angry when you want to put unnecessary effort? Everybody will be angry, right? To put on the extra effort means the muscle mass has to be increased, and that is nothing but hypertrophy. This is an anger arousing situation. Hence, most of the hypertensive patients tend to lose their cool and become angry at the slightest drop of a hat. Anger on contradiction. Anger. Yes, anger on contradiction, anger easily, anger involuntarily, anger about pain, something which acts as an impediment. Pain means it need not be the physical pain always. Yes. And anger when disturbed, anger when interrupted, temper tantrums, anger with obstinacy. Yes. Anger, temper tantrums, opposed when in the least. And that is Thuja, Vijayakar sir is saying. Okay. Yeah. So this is how it is. So what is this now? When you're dealing with a hypertensive patient, yes, you know that there is some resistance. What is hypertension after all? We will talk about hypertension today. Yes, I think we will stop with the reading. So what is this hypertension? Here the heart becomes hypertrophied. Why? Because the heart is not able to pump the blood to the different parts of the body through the arteries. What is happening here in the arteries? The arteries are not very well receiving. The arteries are kind of rejecting. The arteries are kind of resisting, showing the resistance. So where is the resistance in your life? To whom do you have the resistance in your life? Is it your father, father-in-law, or boss, or your neighbor sometimes? Or whatever, the traffic, or what is giving you resistance? Yes, and this is where you have to convert the symptom into the rubric. Somewhere the patient is feeling enormous amount of resistance, and that is the reason why after after coming above the inflammatory stage, after coming above the psoric stage, it is going into the constructive defense. That is the deposition of the cholesterols in the arterial walls, in the tunica intima of the arterial walls, and along with that, side by side, what is happening? The hyperlipidemia happens. What is that? So the cholesterol levels are on the increase. Why is that? Because of the injury, threatened injury. Because of the threatened injury. So anytime an injury can happen anywhere in the arteries, in the tunica intima of the arteries. So cholesterol kind of runs along the blood, runs along the arteries in order to find out where the injury is happening, and in order to cement it down, in order to smoothen it down. So the cholesterols are actually helpful. But then when it goes beyond a level, you know that there is some threatened injury there. And this is the reason why the patient is having a hyperlipidemia. And this is the reason why the patient is having that difficulty in the passage of the distribution of the blood, and eventually the hypertrophy of the heart muscles happen. So the lifestyle, again, it is a lifestyle disease. And you have to find out the resistance. Where is the patient having lot of resistance? Convert that into rubric. And then, of course, looking into the disposition of the patient, again, the anger, yes, and the thermals and thirst, you will be able to find out a remedy. So initially, in psychosis, the systolic pressure should come down. The diastolic should come down. Diastolic is what? Diastolic is nothing but the pressure during the relaxation, and systolic is the pressure during the contraction. So that will be high in the psoric or in the pseudosyphilitic thing. In a psychosyphilitic case, it can be like 200/110. What is the reason for hypertension without hyperlipidemia? Hypertension itself is a vast topic. There you will have to find out, is it a primary hypertension or a secondary hypertension, Rosemary? So if it is a secondary hypertension, there can be renal pathology involved or the liver pathology involved. And hence the hypertension comes in. Here you may not be able to find out the hyperlipidemia. So if it is an essential hypertension or a primary hypertension, lot of anger going into the next level, constructive defense, there you can always expect and that fear of injury, everything will be there. No, there you can expect a hyperlipidemia. My father-in-law recently was angered with my mother-in-law frequently, and now he is suffering with MI. Yes, due to blockage. Anger has the effect, yes. The clot formation, the resistance. And here, what is that? In MI, what rubric will you take? Because it is fast-moving psychosyphilitic. It is fast-moving psychosyphilitic because the blockage is there. And you will have to take insanity, suicidal kind of rubrics in order to deal with myocardial infarctions. Yeah, here you cannot prescribe upon the psychotic thing. AMH and torch test can we do during periods. Day 3 of the periods. Sai Narendra. And we were talking about the hypertension, 220/110. In 220/110, how the BP should come down? Initially, the psoric thing, that is the systolic. The systolic thing should come down, and then the psychotic will temporarily increase. Good sign. And the psychotic BP should slowly come down eventually. So if BP is different in both hands, BP, obviously, it will be different in both hands. Obviously, the BP will be different in both hands. How? According to the pulse pressure. How much is the pulse pressure? 20 to 30 mm of mercury. So that much is allowed. Take the average. Sophia is giving you an idea. Take the average. But then the different in both the hands according to the pulse pressure. Today activity. So coming to the BP again. So psoric BP will be something like 150/80. For a child of say 15 years old or old. Huh? Am I clear now? For a child of 15 to 16 years old, the BP is 150/80. Recently, I had a child of 16 years old. Apparently, he had giddiness and he was brought from the school directly here. And his BP was high. It was 140/80. So it is a psoric BP. It is a psoric BP. And here, of course, the stress and all that, no, the school stress or whatever stress he has, that will be converted, that will be taken as an ailments from rubric. Ailments from rubric. Somewhere he had got the anger. So what is that anger? Some ailments from rubric we will take and prescribe. And what are you expecting here? The 140 should come down to 130 and then it should come down to 120 now, or 140 can come down to 120 or even to 110 easily in the psoric BP. And if it is a psychotic thing, how it will be? 150/110 or 150/120 or 150/130. So these are the BPs of the psychotic variety, where the heart has no relaxation at all. The heart, the hypertrophy is there, and then there will be no enough space for the heart. So the heart will be kind of always under tension. And if it is a syphilitic thing, it will be like malignant hypertension, 220/110, etc. So that 220 thing, no, that is the systolic thing should come down first. There will be a transient rise in the diastolic BP, and eventually that also should come down. Shiny is asking something. For a patient, left hand, I couldn't get the readings, but on right hand, I got. Why is that so? Could you feel the pulse, Shiny? Unmute and tell me, no? You will be able to measure the BP in all the, if it is a brawny swelling, if there is a brawny swelling, what do you mean by brawny swelling? A non-pitting edema kind of thing, no? After mastectomy, when the lymph nodes are also removed, no, there can be lymphedema kind of thing. There, sometimes you will not be able to take the BP properly. You will not
Ma'am,
be able to take the,
excuse me, ma'am. Ma'am, I tried radial pulse, brachial pulse, both I didn't get. But on the right hand, I got both the readings.
it can be only structural. It cannot be functional. Like it can be structural means there can be some fat layer or something, no? Because of that, or maybe because of obesity. This is just like the lab people are saying, no?
But she is very thin, emaciated lady, ma'am.
Sophia, can you elaborate about this Takayasu's disease? I am not thorough to talk about that now. What is that? In that,
Ma'am, it's an arterial disease, ma'am, where the blood circulation to the peripheries will be affected. It's called a pulseless disease. Pulseless disease, ma'am. Yeah, it's a vascular condition.
will you have any cyanosis there then?
Yes, ma'am, there can be a cyanosis.
So do you have any cyanosis here in this case, Shiny?
No, ma'am, no. Only thing she tells, she has a means compared to right hand, she has a weakness of the left hand. That's all. But she
You are
can do
not
all
able
the
to
work.
feel the pulse means it is detrimental. Without pulse, what is life?
I
Yes.
couldn't feel it. Both brachial and radial, I couldn't get.
Either you will have to send the patient for a
Okay, ma'am.
Doppler study, Doppler analysis to find out where the block is there or what is happening to the pulse. That has to be investigated. That has to be investigated. If you are sure that you are not able to feel the pulse, then gone. That is detrimental. That is syphilitic. You have to find out where the syphilis is. You have to do the proper investigation. Okay. If it is due to psychotic reasons like brawny edema, etc., or because of the too much of insulation, too much of roundedness of the hand, and all, sometimes you may not be able to feel. But then, is there a case where you will not be able to feel the radial pulse? No, in every case, you have to feel the radial pulse. There is no question of not feeling the pulse. All the superficial pulses should be felt. Should be felt. The deep, of course, you can't. In Takayasu's disease and all, no, if there is no arterial supply, if there is no pulse, then it will go into gangrene. It will be showing the cyanosis. That will be there. Rule it out, dear. Don't take it lightly.
Hi, ma'am.
Yes, dear Swati.
Ma'am, regarding treating of autoimmune thyroid cases, like
Yes.
after giving the state prescription,
Yes.
once the ATPO, ATG levels is been coming to the normal,
Yes.
it can it increase again, ma'am, with the same remedy?
No, with the same remedy, it will not increase. It has to come down steadily, which means it was maybe partial similar.
Like partial also can help in autoimmunity. Was my
No.
my question. No.
Maybe the repetition is not enough. Maybe the action, the patient's vitality is so low. In autoimmune, sometimes you will have to repeat frequently. According to the patient, you may have to repeat.
Like same thing happened, ma'am. ATG was 120. So depend upon the state prescription, I have given the platina to 1M. So within 2 months only, it came to 10, from 120 to 10. So I told I will repeat the test after 1.5 months. By that time, it increased to 250. So I
Generally,
thought maybe the repetition is not enough, and I have given platina 10M. Then the patient next after 1.5 months, it is going to 500.
that is hysterical. that is hysterical. Forget about the autoimmunity there. Try to find out what is inimical to the patient there. Maybe you will have to think about another medicine, not platina. If the medicine is platina, then definitely it will the disease will not go to 500 and all. The autoimmunity is fully on there. The autoimmunity has not come down there. Something is terribly wrong in the background of the patient. Something
Can this
you
happen
have to
because
ask.
of external applications, or she took arsenic, Restox without my knowledge for all
Not in
acutes?
autoimmune. Only
Can
where
this-
there is SORA, it can happen. All this ointment application and all.
Okay, okay, ma'am.
But anyway, you have tried repeating the medicine. Yes. And you have found out that it has not helped. Change the medicine. Change
Okay,
the
ma'am.
medicine. Ask into more like existence and all that, because it is going higher and higher, no? So something is definitely wrong there. Ask it, find it out. Okay.
Okay, ma'am.
Very
Thank
good
you.
document. Yeah, thank
Ma'am,
you.
here if they take any acute medicines for cold, cough and all, no? So if any
Yeah.
other disease, it cannot suppress, and here if it suppresses also, here we cannot use CP also, no, ma'am? Because this is more autoimmune, not a physiological.
Yeah. Yes.
Is it right, ma'am?
What is your question? Can we give acute medicines, huh?
No, what she's saying is, patient has taken some other medicines like Restox, arsenic and all for cold, cough and all, muscle pain.
Yes. Yeah, I got it.
So maybe her question was, maybe because of that also, it might have suppressed. That's what.
Yeah, if even if it suppresses, the remedy is not correct, is my answer here to this question, Sai Narendra. See,
Yes, ma'am. Yes, ma'am.
the immunity of
And
the patient.
here we cannot give any CPR, no, ma'am, because of she has taken so many
Yeah.
other
Okay,
medicines.
okay.
It
So I
will
was
not
waiting for
work
that.
here because it is in autoimmune care.
Yeah, yeah.
So
No
CPR is only
sepia
under
here.
physiological.
Yes,
Yes,
no
ma'am. Yes.
sepia here. You have to change the remedy. See, the autoimmunity is going on and on. It is going more higher. Means something
The
is
switch
really
is on. We have
yes,
to off that switch.
yes,
Yes, ma'am.
exactly.
Yes. Thank you.
See, even if you give what I have seen in my practice is, we generally say that when you give kind of acute medicines, if it suppresses word of the topical application or whatever cough syrup you have taken in between, it doesn't suppress whatever or give topical application. The improvement goes on and on and on. If it is a positron, then it works like that. Even if the patient does anything wrong in between also, it doesn't go back to the original state. So just a minute, Kyle Vedi was asking something. In PCOD cases, if the patient is obese, will similimum help in improving the cyst, ovulation and fertility? Yes. The patient should definitely reduce. No need. 120 kg weight lady has delivered. She's having diet and all, exercise and diet are important to all of us. Okay, that is the symptom there. That is what I told you. Them many of the like the haters of the so-called haters of homeopathy say that we are not looking into the pathology. No, we are only interested in inferiority and then give the medicine. According to the keynote, give the medicine, but always give the pathological prescription and the miasm, not forgetting the totality and the symptoms. Based only upon the symptom, pulse imperceptible, give the medicine. But what if it was something detrimental? You are forgetting the diagnosis there. So such kind of cases, you will have to make them do the Doppler study and find out what it is. Okay. Yes, Shubhangi, thank you for the input. That is a wonderful suggestion. If it is a disease symptom, we cannot take the pathological rubric now. No. If it is a disease symptom, you cannot take the pathology. What pathological rubric? We are giving the homeopathic similimum. We are giving a homeopathic simillimum, but giving weightage to the pathology. Giving weightage to the pathology and giving weightage to the miasm, you are giving a homeopathic medicine according to the totality and according to the symptoms. Not forgetting the pathology, not keeping the pathology aside. When you give importance to the pathology, to the changes in the cells, to the report, it will be acting just like the arrow of Arjuna, of Arjuna's arrow to the bird's eye. Pinpointedly, it will be acting. Otherwise, it will be a roundabout way with lot of trial and errors. Diagnosis is very important. Yes, Lata, what I talked about, the applications and positron. Yes. Whatever medicine you are giving after analyzing the patient in toto will be our homeopathic medicine, and Vijay sir generally talk it as positron, okay? So when you are giving that simillimum, what happens? This patient unknowingly applies some topical application or some kind of a syrup or something. And what had happened? It need not go into suppression always. It need not go into suppression always. Why? When you are giving the simillimum, the entire vital force of the patient is revived and it is kind of strong. So in such cases, even if you do the topical application, it doesn't usually go into suppression. If your medicine, if the simillimum given is strong enough, and if the vital force is reviving in full force, it cannot go back just like that. Just by applying one topical application, it doesn't go back. That was my point. Hope you understood it in the right sense. Am I clear?
Yeah, thank you so much.
Yes.
So when can we take a suppression and like when will the body go into suppression, madam?
According to the suppression chart.
If our remedy is a perfect simillimum, whatever we do, it won't go into suppression. But so if it is I can understand that if it is a partial simillimum, then it may go into suppression. Is it right, madam?
According to the generals. If the patient is got layer, it can go into the third layer, or in the second layer itself, from the respiratory, it can go into the GIT. Then you know that it is a suppression. Then you can ask what. What were we talking about? Yeah, when the patient is coming with a suppression, am I clear now? Sorry for the technical glitches. Am I clear? I will just say this sentence and close, okay? Am I clear? Yes, Adira. Okay. So when the patient is coming with a suppression, you will definitely ask, yeah, what have you done? You were improving and what had happened now? Then the patient will say, of course, sorry, doctor, I have used this medicine, that medicine, etc. When the patient is going on and on and on, you don't even know whether the patient has applied some. You would have advised, but then for practical purpose, I'm telling you, you will even forget to ask. Yeah, did you apply anything and all? When the patient is improving, you never ask. The patient would have applied something, but then since his immunity is strong, he has not gone into suppression. That's what I wanted to tell you. Okay. So when the patient is going into suppression, that shows that his immunity is not strong, and which means our medicine is not that right. Okay, guys. It is 11:07. We'll call it a day.
Okay,
Bye.
ma'am. Bye-bye.
Nice day. Yeah, which means our medicine will be partial. Yes, Lata. Or you have to think about that again. May not be the right rubric, etc. Something else.
Thank you, ma'am.
Bye, dears. Thank you.
Thank you, ma'am.
Thank you, dears.
Thank you so much, madam.